Sodium zirconium cyclosilicate for urgent therapy of severe hyperkalemia. Definition: severe hyperkalemia can cause lethal cardiac arrhythmias and represents a medical emergency. Existing therapies do not remove excess potassium, have uncertain short-term efficacy and poor safety profiles, or are invasive and costly.
Kalemia refers to abnormally high levels of potassium in the blood. In normal circumstances, more than 90% of the total body potassium is intracellular. The remaining is in the extracellular fluid and blood plasma. The ratio of intracellular to extracellular potassium is important for generation of action potentials and is essential for normal functions of neurons, skeletal muscles, and cardiac muscles. This is why potassium levels in the blood are strictly regulated within a narrow range between 3.5 and 5 millimoles per liter. As the normal daily dietary intake of potassium varies widely and can be as much as 100 millimoles a day, the body must quickly and precisely react to keep blood potassium levels within the normal limits. This is achieved by two mechanisms: excretion of potassium through the kidneys and intestines, with the kidneys playing a predominant role; shifting of potassium from the extracellular fluid into the cells by the sodium-potassium pump. The pump is mainly regulated by hormones such as insulin and catecholamines. Hyperkalemia is defined as a serum potassium concentration higher than 5 millimoles per liter. Hyperkalemia may result from decreased excretion, excessive intake, or shift of potassium from inside the cells to extracellular space. Usually a combination of factors is responsible. The most common scenario is a renal insufficiency combined with excessive potassium supplements or administration of certain drugs.
Application in medicine. Sodium zirconium cyclosilicate is a highly selective cation exchanger that entraps potassium in the intestinal tract in exchange for sodium and hydrogen. In a phase 2 study as compared with placebo, was associated with significant reductions in serum potassium levels within the first 48 hours of treatment in patients with stage 3 chronic kidney disease, and serum potassium levels of 5 to 6 millimoles per liter. Pros and cons. Pros: acute hyperkalemia, it has potential to become an important option by rapidly lowering potassium levels, delaying or potentially averting the need for emergent dialysis. Cons: most common were diarrhea and urinary tract infections at all doses and placebo in both phases. Issue applied in Ecuador. The kidney failure is usually associated with severe hyperkalemia from the beginning of the damage. Approximately 1 million of Ecuadorians suffer from kidney failure. Conclusion: among all patients with hyperkalemia, open-label sodium zirconium cyclosilicate reduced serum potassium to normal levels within 48 hours, compared with placebo. All 3 doses of zirconium cyclosilicate result in lower potassium levels and a higher proportion of patients with normal potassium levels for up to 28 days. Further studies are needed to evaluate the efficacy and safety of zirconium cyclosilicate beyond 4 weeks and to assess long-term clinical outcomes.
The kidney is very efficient at handling potassium, can deal with wide ranges of potassium intake, and normal individuals can take large excesses of potassium and handle them quite well. Of course, with the progression of kidney failure, hyperkalemia is a very common feature.